with a busy schedule, right? So I think this is the need of the hour. I think many people, find it very difficult with full-time, a full-time job. And, in case you are someone who does, you must be also a working mother, or, someone who is, not finding time to manage diabetes, right? So if that is you, then this session would be a really, really great help for you. So please stay tuned for the session. For today's session, we have with us Hema Malini, who is a Sugarfit health coach. Thank you so much, Hema, for joining us today. So she has lots of users who have, reverse diabetes and have seen amazing progress, right? So if you have any questions that you want to ask her, anything about diabetes or about the topic that she's going to be talking about today, please go ahead and leave your questions in the comments. And after the presentation, we'll be taking up all your queries. So I think over to you, Hema. Thank you so much for joining us today.
Thank you, Shifa. Thank you so much for this opportunity. And a very good evening to one and all present here. Myself, Hema Malini. I will be your I'm a health coach, senior health coach at a Sugarfit. So today topic, it's very interesting and then must needed topic, like how to manage your diabetes during your busy schedule. And if you're working or you're on travel, or if you're having so many of your work, household works and all, how to do it about it, how to manage your diabetes, all those things and all, we are going to discuss about it. Okay, so let me share my screen. Hope my screen is visible to you all. So this topic is very important, and as well as we have to manage our diabetes, because diabetes, it's a metabolic disorder, and as well as we need to manage with your daily routines like your diet, exercise, your medication, sleep, and as well as your activity level. So all those things and all, how to manage it, how you can able to time manage all those things and all. What are the challenges that you are facing during your busy timings and all, and how to overcome all those things and all, we can just go through it. First thing is the common challenges what we use to get it. It's like limited time for yourself. So limited time for yourself in the sense, for your self-care activities. For example, I don't know how many of them are giving time for yourself in the sense, not your daily routines, taking up your me time in the sense your activity level, or maybe you are going through your any of your hobbies, or you are concentrating on your health, whether it is going on good way or a bad way. So all those things and all, we need to give some time during your 24 hours of a time. At least give a 30 to 40 minutes of your time for yourself to concentrate on your health. If you are healthy and then wealth, so that your family members are also be so happy. You are going to take care of your family members. First thing, you have to be healthy for that. Difficulty in maintaining the consistent meal time. So when I counsel some of my users and all, they used to tell that, ma'am, I used to skip off my breakfast. Ma'am, I did not have my lunch at all, or I delayed my lunch around 3 o'clock, around 4 o'clock. The reason is why? Because of they are engaged with some other timing, or maybe they are engaged with some other work. So due to that, they are not wantedly they are skipping off. Due to the busy schedule, they can't able to stick on to the consistent time. So consistent timing is very important. Even though if you are working, even though if you are doing some other work, your body needs an energy, right? So for that, you need to take a correct time of food, and as well as the quantity is also very important. Instead of stick on to the what food it's available and what foods it's not available, thinking of a healthy way, and stick on to the correct timing. The consistent timing is very, very important. If you are having your food around 9 o'clock means morning, 9 o'clock means start with the day around 9 o'clock, your breakfast, and followed by you can have your upcoming meals at all. And inability to engage in regular physical activity. Here, the most of my users, out of 100 means like 50 to 60% of the users, they are not at all spending much time for the physical activities. Physical activity in sense, okay, I will start my day with the 5,000 steps and then 6,000 steps in the day. That is also a very good physical activity. But at least during a meeting, or if you are having a call, maybe if it is a long call for about 15 to 20 minutes, maybe you can walk walk and talk. So that is also a good sort of a physical activity. And then post meal, you can do a 5 to 10 minutes of a walk. If you are doing a post meal 5 to 10 minutes of a walk for all the 3 meals, means automatically that itself which gives you around a 20 to 30 minutes of a time. So so manage your day, and as well as try to do a more physical activity, maybe the weights, or you can do it, or maybe you can do some strength exercise, or you can do a yoga or a Surya Namaskar. So these are all which can one kind of a physical activity. Stress, it's like most of the people we are facing the stress, and this generations we are having it because of the time. Even though we are having a 24 hours of a time, so most of the people, they are not at all sleeping in the night because of the stress, because they are overthinking about the next day project. Okay, what to do this, what to do that, and then what are the meetings I have to prepare about it. Maybe for a household, maybe for a housewife also, like they used to have so many pending works, or maybe they used to think about more family health, right? So they need to prepare the food, they need to take care of the family members, they need to take care of the children's, all the household chores also. It's very important for them, so they are keep on thinking about it. That is also which called as a hidden stress. So hidden stress also which will impact your overall health. And limited time for proper medications or insulin administration. So when the users, or when you people are missing any of the food, so they will think it as, okay, I did not take my food, so I should not take my medications. First of all, we should not skip your meat, we should not skip your medications as well, because if you are skipping of your medication, that is going to be adverse your health effects. It is not at all going to help you at all. Okay, so instead of skipping it, try to have a meal and then followed by the medications for prescribed by the doctor. Don't take any own medications, and don't skip any medications without a doctor notification. Okay, so these are all the most common challenges that we face during our day-to-day life to manage your diabetes, and as well as during your busy schedule. This is not only for the men's, it's also for the women's as well, because when compared to the men, women's having so many works, if they are working, means they need to take care of the home and as well as the office. If it is a men, means the travel and as well as the meetings and everything, it's all comes together as a busy schedule. First of all, so we have to set the right expectations, so right priorities in the sense. So what is first? So first thing that you need to think about it. So I just want to give you one example. So no one can plan your day better than you, right? So you know about your day. Okay, this is my timing, so I have to do these things and all. And then this is my time, I can do these things and all. Okay, because I can't able to, if a coach, she can able to help you out, but then coach, you will be the best person. So sit and then write it down. What are the things that you have to do it for the next day? Okay, at least for 1 week, if you practice this kind of healthy habit, definitely you can find a very good result in your productions, and as well as you can feel a healthy lifestyle. Healthy lifestyle in the sense, you have to give a specific time for your meals, and as well as your physical activity, and as well as concentrate on your work. So most of the time, the some users and all, they used to work like at 10 o'clock and then 9 o'clock till 11 o'clock also, they used to work it for office. So during that time, they used to skip off the meal, or they maybe have their dinner around 9, maybe the late night time around 10 o'clock or 11 o'clock. So these are the things that is going to affect their health. So think it about, okay, so what things have to do with it. So what time I have to take my food. So I should not skip off my medications. I should not skip off my insulin dosage and all. I have to take a proper medications, proper meal time, and I have to do a physical activity. So give more attention to your health. Next, you can come to your family and as well as your work. So first, give a more importance to your health. If you are healthy, you are going to take care of your family members. So obviously, and set a clear and then realistic goal. Realistic goal in the sense, so some people and all, they wants to reduce their weight within a 1 week or 2 weeks, and they used to follow a very strict diet for the 2 weeks or 1 month like that, and then they lost about 5 kg to 10 kg like that. After the targeted, it's got over, they start doing the back to the normal. I mean, the last routine they used to do it. So what will happen? The body is also going to be harmed, and that weight is also not at a sustainable. So whatever things that you are doing it has to be sustainable and then consistent. It's very important. So we have to maintain that calendar. We have to maintain the timing to to yourself. So that will help to improve your overall health. Allocate sufficient time to work on your health. Allocate in the sense regarding your food timing, and as well as your activity, and as well as your sleep, and as well as your mental health. Mental health in the sense to manage your stress level by doing a breathing exercise and mindfulness sessions and all. So give us sufficient time. Out of 24 hours, at least give a 1 hour for yourself. That is called as me time. I think from this session, I want all your people to follow your me time. Me time in the sense, how many of them are doing your own activity? I mean, okay, I'm going to do but 30 minutes of exercise on a daily basis. I'm going to do but 10 minutes of a breathing exercise to improve my mental health. 30 minutes of an exercise to improve my fitness quality. So all those things and all, I want you guys to start from today onwards. So this is going to be seeing a very good impact on your health, and as well as you can see a very good impact on your work wise and as well as your family. Okay, say no whenever it's necessary. If it is, if you are working more than an hour, or maybe if you're stretching your work for a longer durations and you're just sacrificing your sleep, or you're not taking any meals, think it about your health and then take it forward. If it is really urgent, or give a correct set, like, okay, this I have to complete by this minutes. Try to complete at early as possible, and then whatever the pending ones, maybe you can do it at the tomorrow. Don't take too much of stress on yourself. Okay, I have to do it by today itself. I have to take all the responsibility. I have to do it everything. So try to split up with your team members or with your families, whatever up to you, and then try to manage your work on a day-to-day basis. But at least you have to give your time for yourself. And how to manage your time. So first things, plan your daily task. As I told earlier, no one can plan your task than yourself. Okay, so you know, right? Okay, this time I used to wake up, this time I used to go to bed. These are my household work, these are my office work. So all those things and all, just maintain a note, or you can just maintain in your phone also. So whatever it is, just mark it in a calendar. If you are having any time in the morning time, maybe you can use that time for the activity. For example, if you're waking up around 6:30 or 7 o'clock, okay, I want to start my day with a good refreshing walking. Maybe you can wake up early around the 6 o'clock and then do your walking for 30 minutes and then come up and then you can start your work. So that 30 minutes of your work, which gives you very good something like, okay, today I done my day. So I'm so happy for that. So in that way, you will be very, very happy. So set a right and then plan your daily task, not to overburden everything, not to do everything at the one time. So split up by today, okay, I have to complete, by tomorrow I have to complete and all. So in that way, you can just plan it. And schedule a regular meal and then snacks time. This is very, very important. So this I can give you one trick. So what we can do it is, like for example, if you are not having the specific timing of food and the irregular food timings, you are not at all stick on to any food timings and all. I will give you one task. Maybe you can try it and then you can just let me know in the next session also. What you can do, you can just stick on to the time. Okay, 9 o'clock my breakfast time. Okay, I'm not telling you what foods you have to take it and all. Just stick on to the time. 9 o'clock if your breakfast. 11 o'clock it's your mid-morning time. And lunch is around 1 to 2 o'clock. And you're going to take your snacks, evening snacks around 4 o'clock, and your dinner around 7 to 8. Whatever it is, even if your work or a travel or if you're at home, whatever it is, try to stick on to this timing, at least for 1 week to 10 days. Okay, so automatically from the day 11th onwards, your body itself gives you the alarm. So it gets, it creates such an habit for you. Okay, so that around 9 o'clock itself, you feel like hunger. Okay, I have to take my breakfast. Automatically, you have to take your breakfast. So whatever foods it's available, you will take your food. So you will not miss your meal time. You will not miss your snack time. So there is a time gap between each and every meal, so that it is very easy for you to manage your diabetes. So from here after, I want you people to follow this meal timing. That is very, very important. And allocate time for physical activity. So as I told earlier, if you're having so many works in the morning time, means maybe you can do your activity in the evening time, or maybe the post dinner before bed also. So the activity timing, it's maybe some people they say like, okay, morning time walking, it's very good for health. Evening time walking, it's very good for health. Both are good for your health. But the thing like the whether you're giving time or not, that is very important. Try to do an activity maybe in the morning or in the evening, or otherwise in the in between meeting also, just post meal you can go for a 5 to 10 minutes of a walk, or you can do a nitric oxide dump exercise, or you can do a solish push-ups, or you can do some sort of weight trainings. You can carry a 1 liter or a 2 liter of water bottle and do some calm workouts. So these are all small activity. If you're doing it also, that is going to be add on your physical activity. So instead of going by lift, you can take up a stairs also. That is also a good sort of step count that you can do it. Maybe in the phone app, you can just track your health wise. I mean, how many steps you used to completing in on a daily basis, whether it is a 5,000 or a 6,000 steps and all, we can just count it. And set a reminder for medications or insulin injections. This is very, very important for managing the diabetes. The reason why I'm specifically telling you that very, very important in the sense, for example, you did not had your dinner around 9 o'clock or 10 o'clock. Okay. And then you skip off to take a medication, or you have taken your food, but before taking of the medication itself, you have slept. Okay. So what will happen? Your sugar levels will raise. So if you're taking a medications, it will come down to your normal levels within a 1 2 to 3 hours. If you're not taking your medications, it takes at least 3 to 4 hours to come back to the normal. So what is going to be happen is your body gets a more, I mean, your metabolism it's get adverse, and then insulin production it's more, and body it's like overburdening of your pancreas. So so automatically it is affecting your health wise. So instead of reversal, it is going to be adversing of your health. So don't ever please avoid your medications and all. Try to have your correct medication as per the doctor dosage, whether it is a before food or after food, as per the timing in the evening time or a night time, whatever the medication dosage, try to have it. For the insulin users and all, please have your insulin dosage on a regular basis. Don't skip or don't stop any sort of medications. And meal planning, it's your best friend. So meal planning, so this will be the very, very tricky for for a housewife, because they used to plan it. Okay, tomorrow what food to do it. Okay, tomorrow it's a Saturday, whether I can do a variety rice or a normal rice, or Sunday what else I can do it. So they used to think it about what food I have to do it. For the women, for the men and all, they used to plan it. Okay, tomorrow if I'm not carrying the food, what are the other options I can take it in the office. So these are the options we used to have it. So better you can plan your day for the next 1 week. Okay, Monday this food I am going to do it as per your cuisine, as per your preferences. Take it a healthy options. So try to have a more vegetables in your food. Try to have a more protein in your food. That gives you a more satiety, and as well as which gives you a very, very balanced meal. So these are the things that you can plan it for your 1 week, and opt for a quick and a healthy recipes like porridge consistency, or maybe a cereals consistency, or you can take it as a brown bread sandwich. This is also good for you, or you can take it as a smoothie without sugar. So these are the food options that you can take it for your breakfast. And for the dinner, maybe if you're going out, or it is a very, very busy schedule and you're on party and you can't able to take high calorie diet, or maybe you can stick onto a soup or a salad. That is also fine. And pack a healthy snack when or on go. So in the sense, like if you're going out, try to carry your nuts and then seeds, so which will give you more fat and as well as a fiber rich foods, so that whenever you're going out, or you can carry your fruit also. Okay, instead of going for packed foods or any other food options, you can always carry, because fruit maybe it has a shelf life, but the nuts and seeds and all, it's very good, no? So that you can take it at any time, so that you can take it. And foods that you can prepare like overnight oats. So this is very, very simple recipe that you can try it at any time. If you don't have a time to have your breakfast, you used to have it around, have it at the canteen or a hotel, you can have those overnight oats. What you have to do, just you can take just half a cup of oats. You can add a half a cup or 1 cup of water, and then soak it, and then you can just refrigerate. And then once you wake up, you can just take the oats and then you can take it. So this will act as a resistant starch to you. So it will increase your digestion. And then oat, those are better. So it is easily available wherever you are. And then parathas and chicken, fish, tikkas. These are the things that you can take in. For the snacks options like a chaat makanas, roasted nuts and seeds like a peanuts, or you can take it like roasted nuts. Like in some grocery shops and all, you will have it like roasted mixed seeds, mixed nuts and all. It's available. So that and all, you can take it at any time. Just not so much of quantity, just a handful of a quantity. It's sufficient for you. And sprouts, if you're making the sprouts, means that you can take it for a 2 to that day, maybe 1 or 2 days you can take it. And then salads like onion, tomato, cucumber salads, or maybe broccoli salads. So all those things and all you can take it. And pudding, and then sattu powder, protein bites, and then seeds cracker. Protein bites also, sattu powder, like it's like a sattu mavu. So that is also in Tamil. So that is also, it's very good. And then we do have some protein powders also, like a basin flour, and then you can mix it and then you can have it as a smoothie. Like a porridge also you can make it and then you can have it in your thing. Okay. So carry a packed meal foods. So better. So always during the busy schedule, what we used to skip it off is, first thing is food, or we used to have it in the outside foods. So better carry your own meal. That is very, very important, because home food is healthy than any other meal, right? So for example, if you don't have a much time, and then you have to take meals at office only, because you're starting your work around 6 o'clock or 7 o'clock from your from your place itself, means what you can do, just carry a rice item only. Maybe instead of, because in the most of the canteen they used to prepare the polished white rice, right? So instead of that, what you can take a millet rice, or you can take unpolished white rice or a brown rice. Just carry a rice item only, and then whatever the vegetables or a curry, that you can take it from the canteen. This is the last option, but try to carry your meals from house. So this is the last option that I used to give it for my user who have to take their meals at the office. So that you can do it. Or if you are having outside food also, the options of food is very, very important. Don't go for any deep fried food items and all, not too much of a preservatives food and so. So typically you can have a chapati or a sabji, or you can have a South Indian meal. That is fine. So in the South Indian meal, you will have lots of vegetables. So start with the vegetables, followed by you can have your rice, so that it will compensate your rice quantity as well. And then some of the easy option like wrap, you can take it off, or you can have a pulao or a dal khichdi. Dal khichdi in the sense, it's like a tur dal and as well as a rice and with the vegetables. So it is a protein, vegetable, carbs. So all the three macronutrients it's available, so that you can just one variety rice that would give you a very good sufficient energy, that you can take it off. Or maybe just a lemon rice with some vegetables or a green leafy vegetables. If you clean and then cut it in before day itself, so that it is easy for you to cook for the next day morning. This is especially for the housewife, so they can plan the day for the next. So when you wake up and then if you plan it, means it's really going to be hectic for you. So before the day itself, if you plan it, okay, cut it and then put it in the refrigerator, and then you can just take it and then you can just cook it. Okay. And physical activity, it's very, very important, as I told earlier. So this is not only I have to do over 3,000 steps or 5,000 steps in a day, and I have to complete it. Don't start. I mean, okay, for example, for the long 5 to 6 months, you would not at all done any sort of physical activity. Don't start your day like I will complete a 10,000 step after my Hema sessions and all. So don't do it like that. So instead of that, you can start off with a very, very basic and then simple exercise, so that what will happen? So the body is also adapt to it. Okay, you are doing some sort of physical activity, so that you will reduce your injuries as well. Okay, injury in the sense the pain, because if you start off with the advanced level of a physical activity from the day one onwards, it is not suitable for you. So start with the simple, and as well as gradually increase the time and gradually increase your intensity. So not only at the specific time. So in a day, you have to spend around 30 to 40 minutes at any sort of activity, or maybe a floor exercise, or you can do some yogasanas also. Okay, and utilize any break, if it is a long call, or if you're having a break for lunch, means maybe 1 to 1:30 you can have your lunch, 1:30 to 2 you can go for a walk, or you can use your stair climbs to go up and down. So that is also a good sort of activity, so that the post meal spike will reduce, and as well as you're doing some sort of activity. Okay. Glucose monitoring, it's very, very important when it comes to your diabetes. Okay, without monitoring, not able to know whether your sugar levels are under control, or if it is are in the above the range or below the range. For example, if one student is studying in the school, and then without giving any examination, or straight away if he is going for annual examination, we don't know whether he may be a pass or he may be a fail. We need to monitor on a daily basis, at least weekly twice or thrice. We need to monitor your sugar levels by the CGM or by the glucometer, or maybe 3 months once you have to do a HbA1c test where your HbA1c is standing on, whether it is 8 or a 9 or a 10, we need to test. So monitoring your sugar levels as soon as waking up, which will helps you to know about whether you're fasting under the control or not, if your postprandial levels are under control or not. Always keep your sugar levels tracking, whether you can just update in your phone, or you can just maintain your notebook. Also, you can just inform your coaches as well, so that they will also guide you regarding the what else you can do it to reduce your postprandial spike. Okay. And stress management. In the first slide itself, I told you that stress management, it's very, very important, right? If you're not planning your day, automatically the heat and stress is going to be affect your health. Okay. Stress, hormonal imbalance, and diabetes. So it is all like a cyclic method. So try to make your mind and as well as your daily to be a normal, calm questions, and practice a deep breathing exercise to concentrate on your health, what is body is telling to you. Whether it is if you're closing your eyes and then thinking about something, means still you are having a hidden stress. So try to manage your stress, calm down, and then do some breathing exercise, yoga, and then these are all the things that will help to come out from the stress. Or you can concentrate on your hobbies. If you like a gardening or a painting or a dance or a singing, whatever it is, spend some me time. Me time, it's nothing but the time that you are giving for yourself. So in the me time, whether you can follow your physical activity, or you can follow your hobbies, or you can do some exercise also. So all those things which is come, and make time and engage in your hobbies or activities that promote your relaxations. Obviously, when you are doing your when you like, okay, I like to do painting. So whenever I used to be free during my college days and my school days and all, I used to draw so many things and all. But nowadays I'm not at all doing it because of my busy schedule. So don't blame on your work patterns. So take up the time from that. So at least like a 10 to 15 minutes, you can just sit and then you can draw something, and then you can feel that relaxation, and then you can feel that mindfulness. And if you want to talk with, so some of them are very, very happy when they are spending a time with their families, and then when they are spending the time with their friends, they will totally forget about all the stress and all the works and everything and all. So if you wanted to, maybe in the weekly once or twice, it depends upon your availability, just meet your friends and then talk it over at least over the phone or through the chat, or maybe in person. Yeah. So this is regarding. Yes. So this is regarding the busy schedule, how to maintain it during your diabetes management. I hope this session is very helpful for you. So overall, the points to remember, like, make sure that you are giving the me time for yourself, and then take your medications or regular timing, stick on to your meals time, and plan your day, so that, and then give some time for your physical activity. So these are the 5 points that is very important to manage your diabetes, not only your diabetes, to manage your health. Okay, thank you.
Yeah, thank you so much, Hema. It was a wonderful, presentation. There are a couple of questions, so I think we'll go ahead and take up some of them, right? The
Yes.
first question is by Mr. Pankaj, right? So he's saying that his average sugar level is around 134 mg per DL, right? And that is without medicine. So his question is that will it come down gradually, or should he start with medications? He wants to avoid taking any medicines, basically.
Actually, his average sugar levels, which is less than the normal, like a 140, it should be. So 134, it's a normal only, but better you can check it out your HbA1c, because when we are checking the average sugar levels, because that will not gives you the clear idea. If you're checking on the HbA1c, that will gives you the clear idea. If it is less than 7 means, so obviously doctor will go on for the no medication. If it is more than 7 means, obviously doctor will start off with the medication. So all those things are not, which is depends on your HbA1c. Please to check your HbA1c and then consult your doctor. They will tell you about the medication. But other parameters and all you can just follow.
Okay, so there is another question by Miss Yashoda. So she's asking, what is the ideal timing for breakfast, lunch, and dinner?
As I told earlier, whatever time you're waking up, if you're, so some of them are used to wake up around 4 o'clock or 5 o'clock, or some of them they used to wake it around 7:30 or 8 o'clock. So whatever time you're waking up, start your day from that day itself, from that time itself. For example, if you're waking around 6 o'clock means, try to have your breakfast within 2 hours of time. From that, take it, give it up a gap like 2 to 3 hours for the following meals. So 6 o'clock, if you're waking up, 8 o'clock to 8:30, you can have your breakfast. And around 10:30 to 11 o'clock, you can have your mid-morning snack. And 1 to 1:30, you can have your lunch. 3 to 3:30, you can have your snack. And dinner, you can take it around 6 to 7:30. So these are the timings. From the wake up till that, you can just make it as a 2 to 3 hours of a gap.
Got it. So we have another question, which is by Miss Chandralekha, right? So she's asking, can we do walking after food or before food?
Actually, walking post meal, which helps to reduce your postprandial levels. So what will happen is, if you are doing any sort of activity means, during that activity, the body needs an energy. Okay. So whatever foods that you have taken up, so that it's directly, it will get absorbed from your muscle. So post meal walk, it's always best. So post meal in the sense, not immediately after your meal. If you're taking your lunch around 1:30 minutes, you can go for a walk around 2 o'clock. So you have to give around 30 minutes of a time, at least to walk for 10 to 20 minutes.
Got it. And there is another question by Miss Saira. So she's asking, can we have muesli with dry fruits? Is that something that is good for people with diabetes?
Actually, mostly it's a combination of all the dried cereals, right? So that you can take it, but make sure you should not add fatty milk. You can add a skim milk to it. And then this is also here one last option for you. Instead of that, you can take it as overnight soap foods, or you can have it like a fruit salad also. Yeah, one breakfast option. Or you can go ahead with the green smoothies, which is already available in the Besugarfit platform. So videos and all. So these are the things, the easy recipes you can go ahead with. So mostly you can take it, but it should be like a last option.
Got it. So actually, Hema, like there are so many, people who are having a busy schedule, and sometimes they think that a fasting approach or like an intermittent fasting would be, beneficial for their schedule, right? So what is your view on that? Do you think that is something which people can do, or what should they consider before they, start off with something like this?
Yeah, fasting and then intermittent fasting, it's very much helpful for the people with the diabetes. Because it will help to give some time for your body to regenerate and everything. But some of the people, they are thinking like a intermittent fasting in the sense of having the dinner around 11 o'clock and then taking the next meal. I mean the breakfast around 11 o'clock. That is not a perfect intermittent fasting. So intermittent fasting in the sense, you have to take your early dinner. Early dinner in the sense, you have to complete your dinner around 7 o'clock, and next day morning, you can take your dinner around 8 to 9 o'clock. So start with the 12 hours of a fasting. That is ideal for all the diabetes people. So have your dinner around 7 to 8, and then take your next day meal. I mean, your whatever, maybe if you're taking a methi seeds water or almonds, that is your start of your day also. That you can start it around post 7 o'clock, so that you are giving a 12 hours of a gap. So body is also take some time for the regenerate. So don't start off with the 14 hours or a 16 hours. Gradually, you can maybe increase the timing of your breakfast, not scheduling your dinner timing in that way. So gradually you can increase. So it is going to be helpful for the diabetes people. But for the insulin users, insulin patients and all, what we have to do, we need to consider the dosage of the insulin. Okay. Before that, you need to consult your doctor.
Got it. So there is another question, right? So they're asking that because of my busy schedule, I'm not able to hit my goal of 10,000 steps, right? So is there any other exercise which I can do that will help?
Yeah, so as I told earlier, only step is not an only the steps, only the walking. It's not an activity. So we do have another activity like strength and conditioning exercise that you can do it, or you can do some yoga asanas, or you can do a post meal walk. So, for example, if you want to hit a 10,000 steps, means morning time you can go for a walk for a 30 minutes, and then post meal 10 minutes, 10 to 15 minutes of a post meal walk, and then before going to bed go for a walk. So automatically that's itself which comes around the 1 to 1.5 hours of your activity. So your step count will increase. Concentrate on your strength exercise also, not only the walking. Concentrate on the strength exercise. So both goes hand on it so that it will helps for your reversal.
Okay. So another question is by Miss Yashoda. She is asking, does sleep time also make a difference in our health, basically?
Obviously, sleep time is very, very important. And then I saw so many users, those who are working in the night shifts, they are having the fasting was very higher. And specifically for the age like 30s and then 35 plus users also, they are getting diabetes due to the sleep. So sleep it's also a hormonal imbalance. 10 to 6 o'clock, it's a good time for the sleep. So that is the reason before going to bed, if you're doing some breathing exercise, that will improve the quality of your sleep. Some people and all, I used to sleep for a 6 to 7 hours, ma'am. They used to tell, but the sleep quality, it's not at all good. They used to have a disturbed sleep. If it is anything, it's drop also. They used to wake up. It's not a sound sleep at all. It's a disturbed sleep. So try to have a sound sleep, 10 to 6 o'clock. After that, you can start off your day so that your mind and as well as your body needs some energy.
Okay, so Prema ma'am is asking, what is intermittent fasting?
Intermittent fasting in the sense that we are giving the time period. So during that time, for example, if you're having your dinner around 7 o'clock, and the next day morning, if you're having your breakfast or early morning snack around 7 o'clock, means this 12 hours of a gap which called as an intermittent fasting. So during that intermittent fasting, apart from water, we should not take any sort of food. So what will happen? So after your body, I mean, after 8 hours of your fasting, your body takes up the energy from your storage of your glycogen. I mean, in your storage form of a glucose. So that is converts into your energy and it is get utilized for your energy purpose. So this will help for the weight loss. This will help to reduce your insulin resistance. This will help to improve your insulin sensitivity. So this is way we can follow it. But you can start off with the 12 hours of a fasting, 12 to 12 hours of a window. From 7 o'clock to 7 o'clock, you can have your food. From morning 7 to night 7, you can have your food. From night 7 to morning 7, don't have any food. So this is then healthy way of intermittent fasting.
Got it. So we have a couple more questions, right? So they're asking, Nair sir is asking, if I skip a meal, should I still take the medication at the prescribed time? Will I not end up with low sugar?
Yes, if you are skipping off your meal, so why we are taking a medications to manage your sugar levels, right? If you're not at all taking a food, so the sugar levels will obviously drop down. So for example, around 8 o'clock, if you have to supposed to have your breakfast, if you're not having your breakfast, so which will gives you your calories and then which will convert, I mean, it will end up, it will reduce your sugars. Okay, if you are taking the medications along with that, if you're not taking the food, so obviously the sugar levels will drop down. So that is why don't skip off your meal, don't skip off your medications.
Got it. Another question is, after having food, right, again, after an hour, right, they feel hunger pangs. So how can you deal with this?
So if you're having a hunger pan means we need to consider whether you're a slow eater or a fast eater. Because if you're having the food very fast, automatically the body will also consider the food is not at all sufficient for you. Okay, so try to have your food for 15 to 20 minutes. Slowly start with the vegetables, followed by your protein, followed by your carbohydrates, so that it will slowly digest your things. So if you feel like hunger pang means maybe if you're taking a more carbohydrate foods, those that may be the reason you feel after a 1 hour you feel like a hunger pang. So start with the vegetables followed by your protein, so that at least for a 2 to 3 hours you don't feel like a hunger at all. So change your eating habits. That will be the best remedy for that.
Okay, got it. Another question is, how do we manage our diet while we are on any vacation?
In vacation and during travel and all, what we used to do, So during travel, it is not like that we are keeping our health in the some locker and then we are going away. It's not like that. We are carrying those. So during travel and then vacation, we have to be more concentrate. We have to more conscious about your health because of the food and as well as the sleep and your travel. During travel, you may be walking and then activity level, everything it's got a disturb. So what we can do, try to have the food that is low fried food items, not oily foods items. Maybe the one meal you can have it as a one day a salad or a soup. In that way also you can just have it. Or otherwise you can carry the sattu powder. So you can just mix it with the water. You can have it for the one meal. Maybe in the dinner. For example, breakfast and the lunch, you have to take it outside. Means at least for the dinner you can have it a little lesser calories. So that will compensate to your sugar levels, not to adverse your effect. So during travel, try to manage your meals. At least 2 meals you can have it out. At least one meal you can carry from your end. Or maybe if you're going out also, maybe you can carry some nuts and then seeds or fruits also. As a meal replacement, you can take it that way.
So a couple more questions here. I think questions just coming in as well. So I just read them as quickly. So this is by Miss Preeti, right? So she's asking, do people with diabetes have mood swings?
Yes, mood swings is also there if they don't have a proper sleep and then if they are having any hidden stress and all. So try to concentrate on a meditations and then yogasana. That will help to reduce their mood swings. And as well as age factor is also important. If they are near to the 50s or 60s, so that is also there. Mood swings, if they are on the menopause period, they used to have it.
Got it. So Lakshman sir has two questions, right? So one thing is he has lost a lot of weight, but he wants to increase it. So how can he do that? And second question is he wants to control his dawn phenomena so that his FBS is under control.
Okay, so dawn phenomena, what we have to do it is, so first question is your weight loss. So weight loss, if you are losing more weight, means we need to check it out your activity level. If you are doing so much of an activity, obviously the sugar levels and as well as your weight is also reduced. So in the diabetes, we have a two criteria. Either it is a weight gain or it is a weight loss. So for the weight loss, we need to concentrate on the more protein-rich foods and then try to have a small and frequent meals. You can have some snacks in between so that it will reduce it. Once the sugar levels under control, the doctor will also reduce the medication. Due to the medication also, some people they may have a weight loss. So once you stop, maybe once you reduce the medication, your weight loss will be stopped and then you will start gaining the weight. That is the one thing. And then dawn phenomenon, this has happened maybe once in 10 members, they used to have this dawn phenomenon. So it will happen during in the night time and in the fasting levels, it used to be high. So what we can do, you can take some bedtime snacks that will help to maintain your sugar levels throughout the day. Throughout the night, and then your fasting levels will maintain it. So bedtime snack in the sense, maybe you can take some nuts or maybe a chia seeds water that will help to maintain your sugar levels.
Okay, got it. So there is another question, Hema. So the question is, if can we do one day where we're completely fasting, only drinking water, and can we skip medications on that day? Is there something that you would recommend?
Yeah, one day fasting, one day full day fasting means we need to check it out your health status, whether what kind of medications you are taking out and then how many years of a diabetic. We need to check it out. It depends on that only. The coach will guide you. And then my suggestion is that I have to take your profile thoroughly. After that only I can suggest you the water therapy or not. Because if you're not taking enough food also, if you're skipping off the meat, that is also going to be health. So instead of that, maybe you can skip off one meal and then you can start just 2 meals, just having a sprout salad, or maybe you can have a vegetable salad and then soup for the one day. Instead of skipping the full meal, you can take it, you can skip off only the cereal based products like rice, wheat and all. You can take it like a vegetables and then fruits. These options you can take it. Yeah.
Okay. So Homai sir is asking, can you guide which brand of sattu powder is good, or is there anything that you would recommend?
It's place to place it's vary. So sattu powder we have it like Manna Health Mix, it's there, and then some other products it's also there. But we need to vary your. It depends upon your locations. You need to take it up. So whatever the products, so make sure it should not contain any preservatives. It should not contain any additives and all. So think just go through the nutrient ingredients list and then you can take it forward. It should not contain any refined flour. Refined flour means maida. So avoid it those things.
Okay, so this is another question by Mr. Rafat, right? They're asking, after having dinner at 7 p.m., his sleep time is around 10 p.m. And during this time, he has hunger pangs again. So he's asking, can I take something simple at that time?
Yes, before going to bed, you can have some nuts or a chia seeds water. So that will help to maintain your hunger pangs. And then if you're taking your dinner around 7 o'clock, try to go to bed around 10 and then try to go to sleep as much as possible. Okay. If you're having some food in the night, again, your digestion is starting. Again, your body has to concentrate on your digestion and as well as your sleep. So it's going to be disturb your sleep.
Okay, got it. So Nari sir is asking, what exactly is dawn phenomena?
So dawn phenomena, it's nothing but some people they used to have a sugar levels drop in the midnight time. Okay, and after that, what will happen if it is so? Our body, it's a very magic things. Okay, so if your sugar levels are dropping down, immediately what will happen? The storage glycogens and all it get utilized for the calories, and then it get converted into your glucose, and it will start increasing your sugar levels. Okay, if your sugar levels are high by the insulin, it will get maintained. So our body which will try to maintain your sugar levels. So some people they will have a defaultly they will have a dawn phenomena in the midnight. They used to have a reductions in the sugar levels, and after some time in the morning time they used to have a high sugar level. For example, around 3 o'clock the sugar levels it's around 80 or 90 below 100s range, and in the morning fasting time it's like a 150s or a 60s. So this is because of the glycogen storage, it converts into your glucose. So that's the reason for the dawn phenomenon. This has to be maintained by the proper sleep and as well as a bedtime sleep.
Got it. So this is, I think, one of the last questions, right? So this is by Miss Divya. She's asking that she's been recently diagnosed with pre-diabetes. So how can avoid getting diabetes? Can you please advise?
Actually, if you are a pre-diabetes, means this is not happened in the within a 1 month or a 2 month. It is already for the last few months. So now only it's got a diagnosis. So not to worry so much. So think it about your health ways. What you have made it a mistake, whether regarding your sleep or your daily routines or the physical activities, whether your weight. So think it about in that way and then try to concentrate on your diet. Give some time for the physical activity and then get a good sort of sleep, like 7 to 8 hours of a sleep. So try to have your early dinner. So these are the things that if you start following it, it's also without medication itself, you can able to maintain it. But you can just check it out with the doctor once whether you need to start with the medicines or not.
Okay, so I think we have a couple more questions, Hema. So they're asking, how is strength training going to help me, improve my muscles?
Yeah, actually, we have so many physical activities like the cardio and then strength exercise and all. So strength exercise which will help to improve your muscle mass. So that is directly it will. So whatever muscle mass if you are improving, what will happen? It will reduce your visceral fat. So visceral fat is also so body weight and then visceral fat if it is increased also, that is also directly connected with the diabetes. So that is the reason we are concentrating on the more strength training exercise to improve your muscle mass and to reduce your fat accumulation.
Sorry, am I audible?
Yes, yes. Yeah.
Okay, great. So there are a couple more questions. I'll just quickly read them out to you. So this is Mr. Mehta, right? So he's asking, can we go for protein powder to make up for the protein requirements if they are vegetarian?
If you are a vegetarian, we have all the pulses and then sprouts based, and as well as you can have the dairy products like a paneer, and you can have a mushroom. These are all a very good protein rich. So depends upon your weight and depends upon your how much of protein that you are taking, and that you can take it forward for the protein powder. So not to start with that, first you can for the vegetarian or a non-vegetarian, they used to have a non-veg foods. So the proteins and all along with that, the fat is also going there. But for the vegetarians, you will have a good sources of protein. So that is also you can take it. In a day itself, if you are making any green leafy vegetables also, make it as a dal with a green leafy vegetable so that it will give you a protein and as well as a fiber. So on a day-to-day basis, take it as at least a half a cup of 1 cup of protein.
All right. So this is I think the last question, I guess, as of now. It is by Mr. Ashok. He's asking, how do you reduce the glycogen stores?
Glycogen stores. Actually, glycogen stores, why should we to reduce it? Actually, glycogen storage, it is very good for your health. I mean, if it is any hypoglycemia, or if you are not having food on time, or if you are on a fasting, if you're not taking food, or if it is a delay, means that is act as a backup. Okay, so whatever, if you, so for example, I'm talking and then I did not had my evening time snack. I had my lunch. So lunch is already exhausted within a 2 to 3 hours. So still now I'm talking, but still I need an energy, right? So my glycogen storage is only in this utilized for my energy purpose. So it is like a reservoir. If it is more than that in the sense as a body fat, then we need to concentrate on the reductions in your fat loss. But glycogen storage, it's good for your health.
So Hema, I think there is one last question. I'll just take it up, right? This question is, like, can we take jackfruit powder? Is that something that is recommended?
Yeah, jackfruit powder, it's a very good hypoglycemic effect. Jackfruit seed, and then jamun vinegar. So these are the things and all which are very good. And then jackfruit powder, what you can do, you can just mix it with the wheat flour and then you can make it as a roti. So that will be the very good option. So nowadays it is a little trendy topic. Yeah.
Okay, great. So I think that was the end of the questions. So thank you so much, Hema, for answering all the questions so patiently. And I just
Thank
want to
you.
thank all the audience as well and the participants for being so, like engaging and, putting up all your questions. I think it's been really great. I think we've answered some amazing, questions. And we've also, I think the presentation was amazing. So I think we got a lot of information today on how you can actually manage diabetes with a busy schedule. So thank you so much, Hema, for joining us and spending your time with us today.
Thank you so much, Steve, and all the best for everyone. So try to manage your diabetes during your busy, or if you are on a travel, also concentrate on your health, because health is going to be your wealth, and as well as health is very, very important on your day-to-day life. This body only you're going to carry for the 50 years, 60 years, 70 years. So concentrate on your body and talk to your body, and then what is it, and then concentrate on your health, right? And then try to build up a more healthy habits like physical activity and your food on time, and then medications, your sleep routine, and then timely food, everything you need to concentrate. Yeah, thank you so much. I hope the session is very helpful for all the viewers and all. So thank you so much for this opportunity.
Yeah, thank you so much, Hema. Thank you so much,
Thank
joining.
you.
Thank you so much, everyone, for joining in.